Alrighty, so I'm here with Jake. Jake just had a fracture of his patella 6 weeks ago. He's been casted. He's just coming out of it. So as far as his phase of tissue healing, he's at the end of proliferation, maybe in the start of maturation. So with him, we finished our treatment. We're going to be coming in. We're going to be doing some ice at the end of treatment so that we can help to reduce swelling, reduce pain, and just like reduce the circulation to that area just towards the end. Other than that, when I come in, I'm going to check, make sure he doesn't have any cold intolerance, any decrease. Well, for contraindication, it would be cold intolerance, any peripheral nerve damage that's trying to repair. And then for precautions, it would be like decreased sensation, decreased cognition, and just like an open wound. So I'm going to come in, I'm going to say, Jake, do you have any like cold intolerance diseases like Raynaud's disease by chance?
Not that I know of.
No. Did
No.
the doctor say anything about you having any nerve damage to your knee that's trying to repair itself?
No, he didn't say anything about that
Okay.
either, no.
Do you have any poor circulation to that area, poor blood flow that you know of?
I don't think so.
No?
Yeah, I think
Okay.
I'm good in that.
And then I was inspecting skin. I was just say, Jake, is it all right if I put my hands on your leg? I just want to make sure we don't
Yeah.
have any open wounds.
That's good.
So I'd come, I'd make sure that where I'm going to put the ice pack, there is no open wound. I would then ask him if, do you like having cold on you, or you just absolutely hate having cold on you?
I think it's good. It usually helps.
Okay.
Yeah.
And then just communicating with him, I noticed that he does have good cognition, so he would be able to tell me otherwise. So I'd be okay. I'd go ahead and I would apply the ice pack. So I'd come over with the ice pack and say, okay, Jake, so what we're going to do is we're just going to put this gel ice pack on your knee for about 10 minutes. Is that all right if we do that?
Sure, yeah.
Yeah, okay. So I got a pillowcase right here to get 2 layers between the ice pack, the gel pack, and his skin. So I would go and I would set that gently over his skin. And since I've already inspected the skin and everything, I know that we're good to go. I would then take this strap. I would lift your leg up just a second here. And I would strap that down onto his knee just to hold it in place so we can get the most contact possible out of the ice pack. And then after that, I would just tell him just the point of what we're doing it. So, Jake, what we're going to be doing is we're just going to be leaving this here so it can decrease pain. I want it to feel cold, but I don't want it to feel so cold that it feels like it's burning your skin or cause any other awkward sensation. I don't want you to feel like you're getting any like tingling or anything down your leg. I don't want you to feel increased pain. I just want it to feel good, but cold. Does that make sense?
Yeah, okay.
Okay, so after I did that with him, I would make sure to give him a bell. We don't have a bell with us, but just for the case of the video, I'd say, I'm going to leave this bell in here with you. If you ever feel anything weird going on and you feel like you don't like it, ring the bell. If nobody comes in, remove the ice pack because we don't want that burning you or
Okay.
causing any other damage, okay?
Yeah.
And then I would also set a timer on my watch here. So I'm going to go ahead and set a timer for 10 minutes. So I start the timer. I set the timer for 10 minutes. And then I would leave the patient for 10 minutes. So I'd go ahead and leave. 10 minutes is up. I'd come back. I'd ask him. I'd say, Jake, how did that feel? Did that feel okay?
Yeah, that was good. That didn't really have any pain or anything. It was just cold.
It just felt cold. Okay,
Mhm.
perfect. Did it feel like it made it feel better at all? Did it feel like the pain's a little bit less after?
I think so.
Yeah.
Yeah.
Good. So I'd go ahead and just take everything off, roll it all up, and get it safely put away so that nobody's tripping on anything. And then after I take the ice pack off, I would go ahead and inspect his skin, make sure, right, it would be cold to the touch, which is normal, but I would want to make sure that there's no signs of frostbite or that the skin is like too tight, because that would be one of the signs of frostbite. And then I would want to make sure that his circulation at the lower part of his body is still okay. So I'd just check for some capillary refill, or I could take his socks off and do some capillary refill on his toe. And then from there, he would be done with his appointment and he would be good to go.